Your knee is locked and you can't move it. Here is exactly how to unlock it safely in the next 3 minutes. First, stop trying to force it. Forcing a locked knee can cause serious damage. If you have severe pain, visible swelling, or your knee is hot to touch, you need emergency medical care right now. For everyone else, let's unlock that knee. Your knee is locked because something is physically blocking movement. Usually, it's a torn meniscus piece, loose cartilage, or severe muscle spasm. The goal is gentle coaxing, not forcing. Immediate unlock techniques. Technique number 1, gravity assist. Sit on the edge of a bed or chair. Let your locked leg hang down naturally. Gently swing it back and forth like a pendulum. Don't force bending. Let gravity do the work for 30 seconds. Technique number 2, heat and gentle movement. Apply heat for 10 minutes using a heating pad or warm towel. Heat relaxes muscles and increases blood flow. While heating, gently try to straighten and bend within your pain-free range. Technique number 3, muscle reset. Tighten your thigh muscle and hold for 5 seconds, then completely relax. Repeat 5 times. This can reset muscle spasms causing the lock. Technique number 4, position change. Lie flat and slowly slide your foot toward your buttocks along the bed. Only go as far as comfortable. Hold 10 seconds, then slide back. Repeat 3 times. Technique number 5, partner assist. Have someone gently support your leg while you relax completely. They should move your knee very slowly and stop immediately if you feel resistance or pain. Most locked knees respond to the gravity technique combined with heat. Give it 10 to 15 minutes before trying other methods. Once unlocked, don't celebrate by walking immediately. Rest for 10 minutes with ice. Then test gentle weight bearing. If it locks again or feels unstable, you need medical evaluation within 24 hours. When to get help. See a doctor if your knee locks repeatedly. Unlocking causes severe pain, you hear clicking or grinding sounds, or the knee feels unstable after unlocking. These indicate structural damage requiring professional treatment. Strengthen your thigh muscles with straight leg raises. Avoid sudden pivoting movements. Address minor knee pain before it becomes major problems. If this unlocked your knee, hit like and subscribe for more emergency joint solutions. Comment which technique worked for you to help others.